Hi, I'm Martha. Welcome to Essential Somatics. Today let's talk about how to relieve the pain of temporomandibular joint dysfunction. Now, if you've ever had TMD, temporomandibular joint dysfunction, commonly also referred to as TMJ pain, you know the experience. Your jaw is tight, you can barely open your mouth, chewing is really painful, and you might even be wearing a mouth guard because you wake up in the middle of the night grinding your teeth and you just can't relax your jaw. The TMJ is the joint between the lower jawbone, the mandible, and the temporal bone of the skull. And it's responsible for jaw movement. And the muscles that move the TMJ can become extremely tight in response to stress, like dental work, emotional stress, mental stress, or habituation of the pattern of slumping and collapsing so common to many of us these days, which we refer to as the red light reflex. The good news is that these muscles are no different from any other muscles of your body and that they can learn to relax and move easily again because they learned how to stay tight. Yet there's always a full body pattern of muscular tension in the center of the body. And I encourage you to not only do these explorations I'm going to show you, but to learn to relax the back, front, and sides of your body for optimum long-term results and to integrate the movement of the neck and the jaw. So these muscles that move your jaw can be felt in the cheek. And as you open and close, allowing the jaw to slide and slide side to side as well, you can feel what's going on. When you develop sensory-motor amnesia in any of these muscles, you might hear popping when you open your mouth, or your jaw might just open in a little bit of a zigzag. So let's do a few gentle, easy somatic explorations that will begin to get the muscles of the jaw back under the voluntary control of your brain so that the TMJ joint can hinge and slide and swing with more range of motion and a whole lot less pain. As you do these movements, don't forget to breathe. Do them in front of a mirror. This is optimum because it will give you an accurate idea of what you're doing, especially if you know that you have a misalignment or you feel popping in your TMJ. You can also choose to sit in front of a mirror. So if you do that, just be sure you're sitting balanced on top of your sitting bones with your chest open and relaxed and your head on top of your spine and not in front of it. Let's get started. Put your fingers just below your cheekbones so you can feel the jaw muscles moving. This will help you sense whether the muscles on one side are working harder than the other side. And go gently. These explorations can be very powerful. Begin by assessing your present range of motion. Feel how the muscles lengthen to allow the jaw to drop open and slowly release to allow the jaw to come back to rest. Repeat that one more time and only go as far as is comfortable. Now put two fingers gently on the tip of your chin and guide your jaw open and shut. Now add a little bit of feedback and pressure under the tip of your chin and slowly open against this gentle pressure. Don't change the pressure, but slowly allow the jaw to close as your finger comes along with the chin. Notice if the movement is jumpy or jerky. If it is, slow the movement down and focus your attention on smoothing out the movement. Nice. Now gently tighten the jaw and put gentle pressure on the chin as if trying to open the jaw. Slowly allow the jaw to float open and then closed again. Repeat this one more time. Now let's glide the jaw side to side. Open the mouth just a bit and slowly glide the jaw to one side and slowly glide it to the other side. Which side is easier to glide to? Notice how as you glide to one side of the jaw muscles becomes tight as the other side releases to allow for the movement. Can you make this smooth? Now let's open and swing the jaw from one side to the other. Take your time and see if you can smooth out the movements. It's as if you're making a smiley face with your jaw. Notice how the jaw can swing and open wide and then swing and close on the other side. And you can do this a few times, coming back through center each time. Again, with your fingers on your chin, guide your chin open and shut. You can feel with the fingers on the cheek, opening your mouth as far as is comfortable. Very, very slowly releasing to open and shut, and notice the sensation. Do these movements slowly and gently and never work beyond your comfort range or into pain. Your brain learns best through conscious and curious exploration. If you notice that your jaw is zigzagging or shaking, as mine did a little bit when I was demonstrating these movements, slow down, go back just a bit, and do the movement again to see if you can smooth it out. The shakiness is just sensory motor amnesia, a place where your brain can't fully control the muscle. It's like a skip in the record or a wrinkle in the fabric. You want to go back and smooth it out. With these explorations, you're giving your brain a chance to sense the muscles that have been chronically contracted and tight, and then to restore their ability to both contract and fully release, so that your TMD is a thing of the past. Remember that it's quality of exploration more than the number of repetitions that you do. Have fun and let me know how it goes.